Hello, everyone. Welcome to today's webinar. My name is Terrell Parker. My pronouns are he and him, and I am an associate manager here at NMAC and our Center to End the Epidemics. I'm really excited to have you all here with us today. We're here to once again share some really important and vital information that is critical to our work to ending the HIV epidemic across the United States. I'm really excited. The work that we're doing with Escalate would not be possible if not for the vision of this person and for the just really awesome work that you've done in your career to help us get to this point to where we can realistically talk about ending the HIV epidemic in the United States. So we have the administrator of HRSA, Dr. Laura Cheever, here to share some remarks with us and to begin our webinar. Thank you for joining us today, Dr. Cheever.
Thank you so much, and thanks for that really overly kind introduction. So as Terrell said, I'm Laura Cheever. I'm the Associate Administrator of the HIV/AIDS Bureau, and I'm really happy to be here today to introduce you to this really important opportunity. First, before I get started, I want to thank the team members at NMAC and their partners, including APT Associate, NORC at the University of Chicago, TRX Development Solutions, and the many individuals from the HIV community that have made this project possible. You've really all worked together incredibly hard to get this project off the ground, and I am so excited that it's going to happen because of the work that you are doing every day. Today's session is really an information session for all of you to learn about the exciting work that we are embarking on to address HIV stigma. This initiative is very important to HRSA and to the HIV program community and to me personally, because it really, I think, is going to help us address the key focus areas for the HIV national HIV/AIDS strategy, as well as to work to end the epidemic. So as you know, within the Ryan-White program, we've seen consistent and significant improvements in viral suppression among Ryan-White clients who are in care over the last decade. However, we continue to hear that stigma is a barrier for many people to get into HIV care or to stay into HIV care. I've heard firsthand from many people at our listening sessions about the impact of stigma on people and the community across the country. And this initiative was really undertaken because of the multiple sources of feedback we've gotten about the need to better address this issue. I can tell you in my own clinical practice, I have patients that in East Baltimore, where they've had HIV for a very, very long time, still have to eat off of paper plates when they go to their family's houses and clean up after they've been to the bathroom with bleach. It's amazing the amount of misinformation and ignorance there is that really is promoting a stigma. That being said, I'm really excited about the Escalate project. And Escalate stands for Ending Stigma Through Collaboration and Lifting All to Empowerment. Really captures what we're going to do if we're able to reduce stigma significantly. The project is to reduce stigma for people with HIV at the client, organizational, and systems level. And once again, we structured it that way because of what we heard firsthand from communities about the various areas we needed to address. So through this project, we aim to help organizational capacity building to implement stigma-reducing approaches so that organizations can better engage and re-engage and retain people with HIV in care. This project also emphasizes cultural humility. Humility is a key approach in care and treatment settings for people with HIV within the Ryan-White HIV/AIDS programs. Certainly that's something we've been working on for a long time, but we know that we still have some significant gaps that need to be addressed. And my concern as well is that if we really are successful in ending the HIV epidemic, getting everyone with HIV diagnosed and those who want treatment and treatment, we're talking about 400,000 to 500,000 new people coming into care. We need to have organizations ready to accept people in a way that is inviting and shows great cultural humility. So we have a lot of important work to do. Today we'll hear from NMAC and their partners about 3 different components of Escalate project, including a team-based training, technical assistance, and learning collaboratives. After hearing more about this initiative, I'm hoping your team will consider applying for one, if not all 3 of these components. Even if this year is not feasible for your organization to participate, we hope that you'll consider participating in Escalate in the future. So on behalf of the HIV/AIDS Bureau, I want to thank you for your interest in Escalate And for those who are able to participate, I can't wait to hear more about the great things that you're doing to address stigma in your Ryan White program. Before I go, I also do want to thank the HIV/AIDS Bureau staff who have worked really hard to bring this to fruition, working with NMAC. And with that, I'm going to turn it over to Terrell Parker and the NMAC team to lead us in a discussion about Escalate and how you can take part in the initiative. Terrell?
Thank you so much again for joining us and sharing your remarks with us, Dr. Cheever. As you said, we see the real implications of HIV-related stigma almost daily in the work that we do. So it is vitally important, as Dr. Cheever said, for you to sign up for one or all tracks of Escalate, because we really hope that you get engaged and get involved. This is a game-changing opportunity. So thank you for your time again, Dr. Cheever. And if we could get our slide deck queued up. Thank you. Well, welcome again. As I mentioned earlier, my name is Terrell Parker. I serve as the project manager for the Escalate project. Next slide. So today you will receive an overview of the Escalate project overall. We will discuss our goals for the project and what we hope to accomplish with, like we said, this game-changing, one-of-a-kind, innovative new program. You'll also receive an overview of our technical assistance track and our learning collaboratives track. And hopefully by the end of this webinar, you will find a way for how you, your organization, and your community can engage with Escalate. Next slide. Quick disclaimer, Escalate is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services and the Minority HIV/AIDS Fund. Next slide. So, what is Escalate, might you add? As Dr. Cheever mentioned earlier, Escalate stands for Ending Stigma Through Collaboration and Lifting All to Empowerment. The words that stand out in that, for me, we want to end HIV-related stigma, but it's really important for us to collaborate if we're going to do this work. Escalate trains and builds the capacity of participants to, one, recognize HIV stigma within the Ryan White Care System programs. Next slide. So what is the purpose of Escalate, might you add? The purpose of Escalate is to reduce stigma for people living with HIV on multiple levels throughout the HIV care system delivery, including on the individual, client, organization, and systems level. But what does that mean? We know, as Dr. Cheever mentioned earlier, we see it every day when folks walk into clinical settings, the type of stigma that they face, the type of stigma that they feel. So we hope that the Escalate project will reduce that stigma that people living with HIV feel. And that's part of the reason why we're focusing a lot of our efforts, or the majority of our efforts, on improving the Ryan White care system. It's because we know so many people living with HIV interact with this care system. And if we can change the Ryan White care system, how much reduction can we do to HIV stigma and really help those individuals living with HIV no longer feel that level of stigma? The program also focuses on implementing various stigma reduction approaches with an emphasis on, as Dr. Cheever mentioned earlier, increasing cultural humility in care and treatment settings for people living with HIV. So, once again, we want to focus on implementing stigma reduction approaches that we know that have been tried, that have been tested, and that have worked for others in the past as well. Next slide. Central to Escalate's mission and our focus is community involvement, cultural competency. We know that HIV stigma is multidimensional, that it impacts people on various social issues with complexities and nuances. We know that HIV-related stigma intersects with many other stigmas. So we felt that it was important for us to have the communities that were the most impacted by HIV-related stigma at the table. So we engaged them throughout the entire process. We engaged them as subject matter experts from every aspect, from the curriculum design to the implementation to the selection of our trainers. We know that if we are going to reduce or eliminate HIV-related stigma, it is vitally important that we have the voices and the minds of the peoples that are most impacted by stigma at the table and helping us to make the decisions on how we're going to reduce stigma. Next slide. So who will Escalate engage? As we mentioned earlier, Escalate will engage Ryan White recipients and subrecipients. Parts A, B, C, and D. That's very, very, very important that you note that. You must be a Ryan White recipient of parts A, B, C, and D. This includes community-based organizations. It includes federally qualified health centers, health departments, planning councils, and planning bodies. One of the questions that we often get is, what if I'm not a direct recipient of Ryan White funds? That is okay. If you are a subrecipient, then you are also eligible to participate in the Escalate project as well. And it's also important that we highlight health departments, planning councils, and planning bodies. There is a place for you all as well in Escalate. Next slide. As we mentioned earlier, it was very important for us to have true community involvement, to hear the voices of those most impacted by HIV-related stigma so that we can develop interventions and strategies specifically to engage these communities. So Escalate will focus on engaging multiple communities, but these are some of the communities that we wanted to highlight and pay specific attention to as we do this work to reduce HIV stigma. So transgender and gender non-conforming individuals, men who have sex with men, Black African American communities, Latinx communities, as well as American Indian, Alaska Native communities as well. Next slide. So as we set our sights on realistically ending the HIV epidemic in the United States by 2030, we know that that means making new HIV acquisitions almost impossible. We want to reduce HIV acquisitions from 30,000 to approximately 3,000, a 90% reduction by the year 2030. We have to be honest with ourselves. As we look at ending the HIV epidemic in the United States, within the 57 jurisdictions highlighted within the ending the epidemic plan, we know that reducing HIV-related stigma is core and essential to that mission. So as we focus on ending the HIV epidemic, it is imperative for INMAC that we also focus on reducing and eliminating HIV-related stigma as a mode to eliminating the HIV epidemic in the United States. Next slide. And this could not be possible without the 65 subject matter experts that we've engaged throughout this process and without our partners who have been pivotal to making sure this work reaches where we are today. So I must highlight and say thank you to our partners at Apton Associates, Lork at the University of Chicago, and TRX Development Solutions for all of their hard work. And you'll have the opportunity to hear from two of our partners today as they share more about the technical assistance and learning collaborative aspects of Escalate. Next slide. So our Escalate model. What I think is really cool about Escalate, and what I think you will also find very intriguing, is that we did everything with intention. As we mentioned earlier, we want to maximize our impact on the Ryan White care system. And we want this impact to be felt at every level, from the person who's working at the front desk of your organization all the way up to your CEO. We hope that there will be some way that no matter who you are, if you're within the HIV workforce and working for a Ryan White service provider, you can find a place for you in Escalate. So there's 3 tracks for Escalate. There's a new and innovative stigma reduction training, and that's led by us at INMAC. You'll hear more about that. There's targeted, time-limited technical assistance, which is led by our partners at Apton Associates, who's here to share more with you today. And lastly, you'll learn about the Learning Collaborative tracks, which is one of my personal favorite, which is a great opportunity to share best practices. And our partners at NORC at the University of Chicago is here to share more about learning collaboratives today as well. Next slide. Escalate technical assistance. Up first, I would like to welcome Hunter Robertson from Apton Associates, who is here to share more about technical assistance and how you can get engaged. Thanks, Hunter, for joining us today. What do you have to share with us about technical assistance?
Thanks, Terrell. It's good to be with you today. As Terrell mentioned, my name is Hunter Robertson. I'm with Apton Associates, and we're the team leading the technical assistance track for Escalate. Next slide, please. So this is our great team at Apt. I know I speak for the entire team when I say we have a deep passion for working on health equity projects and addressing health disparities, and also have a very great deal of experience working on different things that are relevant to technical assistance, like project management, organizational change, knowledge and experience working with Ryan White about planning and strategic initiatives. Next slide, please. So technical assistance is a time-limited tailored program that's specific to what your organization needs. It's for organizations specifically that have the capacity to tackle HIV-related stigma, organizations that have a specific challenge that they're dealing with, and organizations that are looking for specific tailored one-to-one coaching and approaches for addressing stigma. So we're creating organizational level change through very targeted work plans that are customized to your organization and what your needs are. We're going to offer TA in 2 forms through Escalate. There's organization-specific work and then also work at the cohort level. So you'll get to know some of the organizations that are dealing with similar challenges and hopefully have some best practices or knowledge to share with other participants to help solve problems. For the TA track, when we talk about challenges regarding HIV-related stigma, we're talking about something happening at the organizational level that your clients experience or your community experiences when they come to your organizational setting. So try to conceptualize the challenges that we're talking about. Some examples are HR policies and practices, maybe specific to hiring folks with lived experience, making intake forms more inclusive, or getting community engagement in some way to improve your program. Next slide. So with Escalate Technical Assistance, you're going to receive individualized coaching. You're going to be matched with the TA coach from our app team, and then matched with a pool of subject matter experts with lived experience and a history of working in the field to overcome individual level hurdles. If you're dealing with something that's very specific to your organization or local community, we can also help brainstorm best ways to overcome these challenges. Opportunities to participate in co-learning will also be available, meaning that you can learn alongside other organizations that may be experiencing similar challenges, and then the subject matter experts can help connect you to additional colleagues in the field who may have had experience with a similar situation or created new policies or procedures, organizational structures, or hiring practices that have helped them address HIV-related stigma in their local settings. We want to make sure that through Escalate, you walk away with tools, not just at a high level, but specific tools you can use for actual strategies during TA and then after technical assistance, so it becomes a sustainable practice for your organization. We also want to make sure that there's a reduced time from innovation to practice. So reducing the time from thinking about a challenge conceptualizing the plan of attack to putting it into practice and getting measurable results for your community. We want to address gaps in practice as well and translate evidence to practice. We know that that's a big focus for ending the epidemic and for HRSA in general, to make sure that we use the evidence base that's already been established and making sure that you can implement these solutions in your local community. Next slide, please. So if TA sounds like something that might be a good fit for your organization, you're probably wondering what's actually going to be involved in technical assistance. So as I mentioned in the previous slide, you're going to be matched with a trained TA coach that's going to be your point person, someone that you're going to be able to have monthly check-ins with. They'll also help to create a customized work plan for your organization. So using your application and then the organizational self-assessment that happens after you're accepted into the program, we'll create a customized work plan that will link to SMART objectives. So you'll be able to see where you want to be at the end of the 9-month technical assistance period and create a plan to get you there and measure your progress each month. Beyond the organizational assessment and work plan, there are also monthly one-on-one check-ins with your coach. There's individualized organizational trainings. For example, if your organization needs to get a group of folks together to solve a problem, we can facilitate those conversations and make sure they're in service to your work plan and achieving those opportunities. We'll also have ad hoc opportunities so you can know that when things come up, other calls with subject matter experts. We'll have office hours, connections with colleagues in the field, colleagues at HRSA, and other organizations across Escalate. That way you'll be kind of growing with the track of agencies that we're all working with. And then once you have completed technical assistance, you might think, what else can I do to make sure our organization is kind of advancing the reduction in HIV stigma? And that might be a good chance to go to something like a learning collaborative after completing TA. And our colleagues at NORC are going to talk more about that in a few minutes. The other thing I should mention is that when you participate in any one of the tracks, so training that Terrell mentioned, TA, or the learning collaboratives that we'll hear about more in a moment, there are ways to participate in other activities throughout the life of Escalate. There's really no wrong door to getting involved in the project. Next slide, please. So as Terrell mentioned earlier, eligibility is that you have to be a recipient or a subrecipient for either parts A, B, C, or D. And we're also looking for an agency to have what we call a stigma reduction team of 3 to 5 members from your organization. We're going to ask also for a demonstrated organizational commitment to address specific HIV stigma within your organization and community, and the availability to participate in TA sessions. So TA lasts about 9 months, and we're asking for organizations to put in about 3 to 5 hours a month towards TA activities. So it's not just the one-on-one meeting with the coach every month, it's also the work that goes into advancing the work plan. Next slide, please. So here's our current timeline. We're still accepting applications. Applications close on September 3rd, so not too much longer. We really strongly encourage you to think about applying. If you're interested in applying, you can go to targethiv.org/escalate and to apply. Now, the general timeline for folks that are applying, applications are closing, as I mentioned, on the 3rd. We're going to be making decisions in partnership with our colleagues at HRSA around applications in September and October. And then we expect to notify applicants of decisions in October, November, and TA coaches will start that outreach to selected participants at that time as well. And then we'll have a second cohort that will start in March of 2022. Next slide. So this is my contact information. If you have any questions or concerns about Escalate or getting in an application for TA, I'd love to chat with you. You can email or call me. There's also going to be a chat feature here on the webinar today. You can ask questions, or you can ask questions at the end of our all presentations. I'm going to introduce now my colleague Chris LaRose from Newark at the University of Chicago, who will talk more about learning collaboratives.
Well, good afternoon, colleagues. Thank you so much. Thank you, Hunter. Thank you, Terrell. And thank you, Dr. Cheever. If we could move on to the next slide. So NORC is going to be running the learning collaboratives for Escalate, and this is the team, myself, Chris LaRose. We've got a great bunch of folks who are going to be supporting the team, including some great folks who are going to be LC liaisons, which I'll explain further in a second. Let's move on to the next slide. So you're probably wondering, what is a learning collaborative? And a learning collaborative is basically an initiative where multiple organizations come together and study and apply quality improvement methods to a focused topic area. Organizations typically field teams, and we've discussed some of those teams, the stigma reduction teams already, and those teams work together over a 12-month period or longer to engage in learning sessions, which are led by subject matter experts and quality improvement experts, and to actively engage in action periods between those learning sessions to implement the practices and strategies that they've learned. This is really about an important opportunity for co-learning and co-creation of knowledge. Let's move on to the next slide. So the Escalate learning collaboratives are specifically going to focus on testing the implementation of HIV stigma reduction initiatives at organizations like yours that is aimed at reducing the impact of stigma, specifically HIV stigma, but also other types of stigma and discrimination that can exacerbate the experience of HIV stigma on a population that your organization serves. Each learning collaborative is going to bring together organizations that are ready to implement or already implementing stigma reduction activities. So one of the key distinctions between technical assistance and the learning collaboratives is TAs for those organizations that are preparing to implement a stigma reduction initiative, whereas learning collaboratives are for organizations that are already implementing or ready to implement such an initiative. And so we're going to be looking at stigma reduction activities, and the learning collaboratives will provide coaching, will provide peer-to-peer learning. That's a big piece of this. Collaborative tracking of progress according to certain metrics. And as I mentioned, you're going to receive support from stigma reduction subject matter experts. Moving on to the next slide. So the Escalate learning collaboratives, there are going to be two of them. The first one is going to be roughly October 2021 to December 2022 with about 8 organizations. And then the next one in winter 2023 to summer 2024. The first LC or learning collaborative will focus on the topic of cultural humility. And the second LC will focus on another aspect of HIV stigma that's going to be informed by both the interest shown in the application for the second LC, as well as the lessons we learned from offering the first LC. Moving on to the next slide. So what are the benefits of participating in the learning collaboratives? So primarily, you're going to get support for implementing strategies to address HIV stigma. I mentioned that you're going to have opportunities to learn from subject matter experts, but most importantly, you're going to have opportunities to learn from other organizations who are currently implementing stigma reduction initiatives focused on either the same types of populations, the same types of stigma, or related types of stigma. And you have an opportunity to learn what other organizations are doing in the field right now, what they're being challenged with, and how they're overcoming those challenges. We'll also provide coaching with our LC liaisons, as I mentioned, to help you overcome hurdles. And as I mentioned, lots of opportunities for co-learning, knowledge creation, and support from like-minded organizations. But these aren't the only benefits. There's some other ones. Let's move on to the next slide. We're hoping that you'll walk away from after participating in the learning collaboratives, tools to evaluate your progress and assess improvements in your practices related to HIV stigma. As a result, we're hoping that means your stigma reduction initiatives are stronger, they're more effective, and more responsive to the populations or communities that you're serving. We're also hoping, because of the application of what we refer to as PDSA cycles, plan, do, study, act cycles, there's going to be a reduced time from when you implement an innovation to when that innovation becomes part of your standard practice. This will also give you the ability to address gaps in practice, as Hunter mentioned, to translate evidence to practice, which is a very important part of our field right now, and to achieve common goals in terms of reducing HIV stigma. Let's move on to the next slide. So, what will it take? What do you need to do to participate in a learning collaborative? So each organization participating in the learning collaborative will need to identify a primary point of contact, whom we're referring to as the stigma reduction change agent. Similar to TA, we're also organizations to identify 3 to 5 members of the organization who will form a stigma reduction team that will come together and be actively engaged in this work. They're going to be participating in the learning collaborative learning sessions. They're going to be attending affinity group webinars that are part of the learning collaborative, but they're also going to be meeting on their own and implementing various stigma reduction activities back at their organizations. We do want this team to include at least one person who represents members of the population in which your stigma reduction activities focus, as well as people who represent a wide range of roles and seniority within the organization. We'd also like to recommend that this includes both client-facing staff, such as frontline staff, patient educators and navigators and providers, but also support staff and administrative and leadership and executive staff as well, so that we've got the whole organization covered. Let's move on to the next slide. It is going to be a longer engagement than TA. TA, I think the engagement's about 9 months. We're looking at convening a learning collaborative over the course of 14 months, during which time we estimate that team members will need to devote between 6 and 10 hours per month to learning collaborative activities associated with their stigma reduction initiative. And this is on top of the work that you're already likely to be doing, implementing your stigma reduction initiative, and that's going to vary according to the intensity of your efforts and what you plan there. Successful participation in the learning collaborative will require engagement in live and virtual meetings, which we're referring to as our learning sessions, check-ins with our LC liaisons, our coaches, affinity group webinars. And let me stop there for a second and explain what an affinity group is. We're anticipating that within the 8 organizations that participate in the first learning collaborative, that there will be smaller groupings of organizations that we bring together based on similar characteristics and promote a conversation between those groups. And we're going to be hosting webinars specific to topics of interest to each of those groups, which other members will also be invited to. But that's what an affinity group is, and that's what the affinity group webinars are about. We're also going to be asking each of the organizations to participate in evaluation activities, and that includes regularly meeting with your team and completing quality improvement forums. Let's move on to the next slide. So when is all of this happening? Right now, we're still in the application period, and as Hunter mentioned, there's still an opportunity to apply for TA and LCs. The website to go to, of course, is targethiv.org. To be able to find the applications, you go to targethiv.org/escalate and either /learning-collaboratives or technical assistance to be able to get there. Once applications are in, they're going to be reviewed. We're going to notify applicants of our decisions about who's going to be part of what aspect, TA or the learning collaboratives in October. And then between October and November, those organizations that are enrolled into the program will be asked to start beginning some of the pre-work. We'll start our design meeting in early November, and then our first learning session and the kickoff for the rest of the learning collaborative starts in November, the last day of November, the first couple of days of December. Now, I want to note here that we've provided some options for dates because we're trying to make sure that we select a day of the week that works best for all of the organization and all the members that are going to be participating. Let's move on to the next slide. So if you have questions about the learning collaboratives, please feel free to get in touch with me. I'm a senior research scientist at the University of Chicago. We've set up a specific Escalate email address at NORC that you can reach me or any of the other team members at, which is escalate@norc.org. Thanks, Terrell. Back to you.
Thank you, Chris. And I'd like to welcome our other Chris, who's leading our question and answer today.
Hi everyone, Yat Ebene or Yate. I'm Chris Paisano. Also work for NMAC, and I am the coordinator for Indian Country. So thank you also to Dr. Cheever, Chris, and Hunter for those great presentations and the things that we're going to do for Escalate. And so now I'm looking at the questions. I guess this is now time to enter your questions into the chat box or the question box, and we can start there. Can I have Hunter and Chris on camera so you can greet all the great people? Hey Hunter, welcome back. Great presentation. And there's the other Chris. Great job, great job. All right. So now we're just waiting for questions to come through. But one of the things I was going to ask you while we're waiting for the questions to come through is that, for example, I know we've got a lot of Ryan White program officers on board and listening. So my thought was, for their programs, they may actually think, am I eligible, or am I eligible to, you know, I'm thinking about Escalate, but am I really that person to go through? Are you both really willing to like sit down and like calm their fears and walk them through and say, well, maybe I am good for LC, or maybe I am good for TA. So we'll start with Hunter. So I have somebody who just wants to outreach to you. Would that be something that they can do with both?
Absolutely. And you know, as we talked about earlier in the presentation, technical assistance is for an agency that you know, maybe anecdotally they've heard they have a problem with a form that may be stigmatizing to a portion of the community, or they've attempted to hire folks with lived experience in the past, but those folks don't stay very long at the agency for some reason, and they think there's something that, you know, could be modified from an HR perspective. You know, those would, you know, if you find yourself with those types of thoughts, TA is probably a good fit for you. And, you know, feel free to certainly give me a call, email, or just put your application in, and we can help you with that.
And for Chris, especially, Ron, I think you mentioned that as well, but I think for those who think, oh, you know, can I do a learning collaborative? Can you like talk, will you be able to talk with them to sort of alleviate their fears? Ooh, you're on mute.
Apologies, I have a little bit of a tickle in my throat and didn't want to, cough over anybody else. Chris, definitely. I mean, that's what we're here for. I mean, to sort of piggyback off of what Hunter said. If you have had the thought that you need to do something and you're at the point where you've figured out what you want to do and you're doing it, and you want to make sure that you do it well, that's the point where you get involved with a learning collaborative. If you're doing it and you're encountering challenges and you're like, I don't know how to apply this particular piece to the people that I work with and help them out, that's the point at which you speak to the learning collaboratives. We want folks who've got their hands ready. They're working with folks, and we want to help them do that job better.
Great, great. Oh, hey, and I was just thinking, because Chris, you had said, LCs are for those people or organizations who are beginning to implement stigma reduction in their program. But I was thinking in my head, I'm like, so how can a Ryan White program project officer encourage the recipients to participate in TA or LC? For example, say like I'm a medical director and I'm walking through my hospital or my clinic, and I'm seeing that there's a reduction in clients in medical adherence. I'm looking at the chart and everything. So I investigate and see that my intake personnel snicker in front and behind of my client's back, even though we've already started and are beginning to implement some anti-stigma. So like, is it okay now? Am I TA? Am I LC? In that situation, what would be the best? And I can let Hunter as well.
I mean, so I definitely have ideas. I feel like if this is the point where you've already started implementing activities, for instance, you could be implementing an activity like you're doing cultural humility training for the providers in your clinic, and you're finding that some of the providers it's really like sticking with, and folks are taking the time to take a more client-centered approach. They're asking clients about what their preferred pronouns are. They're asking clients about their culture and how this impacts what's going on in their lives and how the clinic feels to them. But then you have other folks who, and I've experienced this working in clinics in the past, they've been there a while. They don't want to change their behavior. They know a particular way of doing it. So that's the sort of thing that you bring to a learning session. Say, we're implementing this activity. We're finding that some of the diehards are not necessarily changing. And we can, in a learning session, we can have fantastic conversation with subject matter experts to talk about how do we change hearts and minds, how do we change clinic norms. We can also have those conversations with other organizations who are encountering the same issues and find out if other organizations have tried things that may work at your organization. That's how I see it. Hunter, I'm sure that there's a way to tackle it with TA also.
Sure. I go back to the intake form example. It's with the kind of interconnectedness of EHRs within our agencies. It's not just a single paper form that you're changing. You're changing something in a data system that means you have to collaborate with other offices that you usually don't collaborate with. You also have to make sure that the changes you're making are the ones that are right for the community to be made. So you have to be able to engage the community in those changes to make sure the changes are representative. You also have to think about, the folks that actually administer those forms when they interact with clients to make sure they're trained up. So it's a multi-layered, set of kind of steps that you have to go through, and that's really what TA is designed to help folks navigate. And I also will go back to your other question, Christopher, at first. The TA commitment is about 5 hours a month we're asking, which is really, I know everyone's stretched in, especially with COVID, and everyone's super busy in the Ryan White world, but 5 hours a month kind of change the impact stigma and do something that's, been called to be changed for so long, but only until Escalate, there's now a program for it, is super important and not a really big commitment to make for such a value to the community and to practice.
Great, thank you, Hunter. And I know we're not talking about the third part that Terrell had asked, and that is individual training. But I was thinking in terms of LCs and TAs, what would be your take in? I mean, there's the paperwork what you were describing, the changing of the process. But I think one thing I'd love to hear from you both is learning that your patients who are living with HIV, those are the people who we need to welcome. And a lot of times I know in your hospital, it's very much the rules. But how would you, either with LCs or TAs, like to somehow change their worldview into like, it's not about me changing the forms, it's really about welcoming our patients, and that's what we're there for. Chris.
So thanks, and I always think it's important to take a patient-centered approach, to put your mind or put yourself in the mind of a patient who's coming into your facility. By walking in the door, in a particular door, am I being stigmatized because that door says HIV clinic? let's say it doesn't. Let's say it says something, less stigmatizing, more appealing, and I walk through the door. But once I get through the door, I'm getting the side eye from either the security guard or the front desk receptionist. I look around and all I see are sort of posters with medical information that don't actually necessarily apply to me, that aren't appealing to me. That's all about creating a welcoming environment. And then beyond that sort of welcoming environment that you get into, when you can see yourself in the images that advertise the clinic, but also in the images that are on the walls of the clinic, the people are welcoming to you when you step up to the front desk, the people ask the right questions when you're taken into an exam room, and that if you have an existing relationship, ongoing relationship with the provider, that they're checking in with you to ask, about what's happening in your life that may affect your treatment or may affect your health. Those are the types of things that I feel healthcare organizations can be working on, but it's not always easy to do, and it's not always clear, what you can do. And Chris, to your point, sometimes you got to fight, with upper management to be able to do those things. And so what the LCs are there for, again, is to provide some guidance on how to do those things, some coaching on how to do those things, but some real world examples from organizations like you on how they did the same thing and how they may be able to affect that. I mentioned the PDSA cycles. Part of that, and this is a key part of the LC, is that what we're doing is we're looking at making a change and then sort of assessing how that change has impacted the way that our clients feel. And so during the 3 action periods that are included in the LCs, what we're encouraging organizations to do is to test out innovations like that, see if those innovations are working, and then adopt, adapt, or discard. If the innovation worked well, let's go for it. If it didn't work so great, but there's some promise, let's figure out how we need to adapt it. And then if it definitely did not work, let's discard it, find something new to test out so that we can improve the lives of our clients.
Great, great, thank you. Terrell, I cannot see the questions. Can you read the first one, please? Oh, you're on mute.
We have a question about training, when we're going to announce the training dates. So yes, we didn't talk a lot about training on this webinar because our application for the first round of training has closed. We have identified our participants for our first round of Escalate trainings, which is great. So I would say approximately by the first week of September, you should see on Target HIV the updated training calendar. We will be offering the Escalate team training once a month. We have a calendar that has been solidified from November of 2021 all the way until July of 2022. So we are going on the Escalate tour, as we call it internally at INMAC. So please be looking out for the first week of September, Target HIV. .org/escalate, you will be able to see our upcoming training dates. We will, as of right now, we planned to have a hybrid version where we would begin doing in-person trainings in April. That is still up in the air. So right now, all of our trainings are still listed as virtual trainings. Of course, depending on the status of the Delta variant or any other COVID-19 variant at the time, we would love to go back to doing in-person trainings, but that will only happen once it is safe and we can keep everyone protected. So as of right now, be on the lookout for the first week of September. We will be releasing our virtual training calendar for the next year. Chris, we do have another question. Are these programs helping organizations cultural humility or HIV stigma in particular? I would say both. I can speak at least from the training perspective. We talk a lot about intersectionality, intersecting stigma, how HIV related stigma intersects with other types of stigma, and how see cultural humility, and a new exciting terminology that we hope to share with everyone, how it really is the key to reducing and eliminating HIV-related stigma. So Hunter, Chris, I don't know if you two want to share maybe from your perspectives um, how those are related in your work.
Yes, so definitely. So it's going to, Sherelle, thank you. You've answered the question perfectly. We are focusing on both. Very specifically, we're focusing on a cultural humility approach to addressing HIV stigma. Cultural humility is sort of a lifelong process of reflecting and critiquing oneself and how one acts specifically in healthcare settings. An awareness of the power imbalances that exist in healthcare settings between clients and providers, or clients and members of the staff there, and actively adjusting, addressing, pushing back against those power imbalances to give more power to the client, so that they can take charge of their own health, play a big role in making healthcare decisions. So we see that as a very important way of addressing HIV stigma. The cultural humility on the part of the organization and the members of staff of that organization is a great way to address HIV stigma. Hunter, I'm sure you have a perspective also.
No, that's totally, I agree with the both of you. I mean, that's the foundation for Escalate, in my opinion. I mean, it's acknowledging that the expertise in the community about understanding what the barriers are, understanding the impacts of how organizations are structured and how those things kind of filter into the environment that people experience, is really kind of the core of how we approach technical assistance. So without cultural humility, I don't think we couldn't have training, learning collaboratives, or TA for this project, and be able to do justice.
Great, thank you, Hunter. Actually, here's another question for both you. We have a rural health initiative whereby staff working in our bureau provide academic detailing and education to healthcare and service providers in rural parts of our state. Our data indicates that people living with HIV experience high levels of stigma with providers in these areas. As such, part of their work is to address that stigma. Are the learning collaboratives appropriate for stigma initiatives that are externally focused and statewide?
Yes, definitely. I feel that learning collaboratives have the opportunity to have an impact at both the organizational level, but also at the systems level. And this is an example of how it could impact, systems level, statewide, practices. This is exactly, the sort of thing that we're talking about. And so, in answer to that question, yes, holler at us. If you want to send me an email, if you need help putting together the application, I want to be able to provide that to you.
Great. And Hunter, did you have any on your side? I know you're TA, but do you have anything to add on that side?
I mean, I think depending on what the organization is experiencing, they could go learning collaboratives or go TA if they had something very specific they were thinking of. I mean, TA can be applied just to an organization of any size, but it could also be applied to a statewide initiative or a regional initiative to address stigma. So, there's, as we said before, there's really no wrong door to ending HIV stigma.
Very good. Yeah, I don't see any other questions so far. Was there anything else that our panelists would love to add? In the view of what do we call them? I can't even think of the word now. Of our project officers, how can we encourage them to reach out to their programs?
I'll start if that's okay. Project officers have a very special and unique relationship with jurisdictions and with recipients. So, from your view, if you see, things from your relationships that you think that Escalate can assist with, refer those agencies as strongly as you can to whatever the appropriate track is, whether it's training, TA, or LCs. You can really use your perspective that only you have kind of at the very high level to push folks to make that change. And we really appreciate and encourage that.
Chris.
I can't, say anything better than what Hunter's said, so I'm just going to add to it. If folks are looking for the application, target hiv.org/escalate, and then either /technical-assistance or learning-collaboratives.
Cool beans. And we have one last question. I deal with Hispanic people where still there are lots of stigmas, plus that I offer mental health, the two big stigmas, working hard against, more of a comment. Oh, okay, so it's more of a comment, working hard against the stigmas. Gotcha.
So yeah, there's also something that I guess we can highlight, that in year 2 for the Escalate training, it will be offered in Spanish as well. There will be a full Spanish version of the Escalate training that's available for individuals who are Spanish speaking. And we plan to launch Escalate in Espanol in 2022.
So look
If I
out for
could
that.
just follow up quickly, I know our colleague who put that comment in there was just making a comment, but it's a very important comment that HIV stigma is not just about the stigma that someone has because they have HIV or they're at risk for HIV. It's also about the various other stigmas. For instance, racism, for instance, stigmas against mental health. It could be homophobia, it could be transphobia. All of these stigmas ultimately make it harder for people living with HIV, to achieve the best health that they can, to be on the medications that they might need, and to also sort of achieve viral suppression. So I just want to say to my colleague who put that comment in there, that's a very pertinent and very important comment.
Exactly. And that's what I love about Escalate, because we're reaching out so many communities. And for my community as well, Native American community and our Alaska Native folks, definitely going to be outreaching as well. All right. Well, if that's it, did you want to wrap up, Terrell?
Yes, if we don't have any further questions, then we will wrap things up for today. So I don't know if we have a closing slide, or if I'm just going to talk my way out of this, but thank you for joining our webinar today. As we mentioned, our application for technical assistance and learning collaboratives, the opportunity is still there until September 3rd. The application is open. You can go to targethiv.org/escalate to apply. As Hunter and Chris generously offered, they are willing to sit down and talk with you one-on-one to answer any questions, ease any fears. I would say that everyone has a place in Escalate. It's all about finding out what place is the best fit for you and making sure that you have the availability to participate. But if you have the availability to participate, I wholeheartedly 100% believe that your organization and your community can benefit from participating in Escalate. So please take advantage of the opportunity to apply. As we mentioned, in early September, we will have the dates posted for our Escalate trainings in 2021 through 2022 as well. So if you ever have any questions, feel free to email us. You can email us at escalate@inbac.org. I believe Nort has an individual Escalate email as well. So you can feel free to reach us, contact. We love hearing your questions. We love speaking to you directly. And let's do this great work. Let's continue to do great work, end HIV-related stigma together, and end the HIV epidemic in the United States. This webinar will be posted to our website, so please share it with your friends, your colleagues. We want everyone across the country to know about Escalate. We're not letting anyone miss out on this opportunity. All right. Thanks for joining us. We'll see you soon.
See you later.